I'm Dr. Zelda Okia. I am a forensic pathologist and a life and weight loss coach. So I recently returned from Hawaii, where in addition to vacationing, I also presented at the National Medical Association conference that was held there in Honolulu. And I presented two cases that we had autopsied at the medical examiner's office, and they showcased complications of diabetes mellitus. And they were both younger men in their 40s. The one was actually carrying a history of type 2 diabetes. The other one had no history whatsoever. So the first case was a 49-year-old male. He was living in his parents' basement. He was morbidly obese. His BMI was actually around 45. Greater than 40 is morbidly obese. The BMI can be less than that if there are other obesity-related complications. He actually did have other obesity-related complications. In addition to type 2 diabetes, he had high blood pressure. He also had osteoarthritis. So this is pain in the weight-bearing joints, particularly in the knees, just from carrying the excess weight. Also, he had anxiety, and anxiety and depression often go together. Depression is an obesity-related condition. Sleep apnea is another obesity-related condition. Even infertility can be associated with obesity. So my index case, this 49-year-old male, came upstairs from the basement, asked his dad for some milk, and basically collapsed right in front of his dad. They called 911 and they could not revive him. The other case was a 41-year-old male, and we got this history from his brother that he was very healthy. He would hike several miles a day, did not go to a doctor, actually avoided doctors because he was so healthy, quote unquote. The interesting thing with him is he had texted his work a couple of days prior and just sent this very strange text message. He misspelled very, Varry, Sickey, Sickey. And I wondered to myself, did he typically send these types of text messages? Because it was very odd, it was very strange, but obviously nobody noticed it. Nobody said anything about it. The following text was just, okay, we'll see you when you're feeling better, and then when he didn't respond, where are you? So, it often makes me wonder as a forensic pathologist, what are the signs, what are things that we should have noticed or maybe we could have seen that we just didn't pay attention to. The interesting thing in both of these cases is when we went to the scene, the apartment or the rooms where they were staying were multiple cans of soda pop, bottles of soda pop. Now the one guy, the 49-year-old, he had the history was that he'd had flu-like symptoms the week prior. So I don't know if maybe he thought he had the flu. He was trying to stay hydrated. I don't know if that was the case with the 41-year-old, but for whatever reason, they were drinking a lot of soda. And now we do know, or one of the symptoms of diabetes is what we call polydipsia. So they're excessively thirsty, excessive thirst. They drink a lot. And then along with that, we call polyuria, where they urinate a lot. And that's just because the blood sugar being elevated causes them to be dehydrated. And so they drink a lot. So both of them were drinking all of this fluid, and unfortunately they were drinking soda pop. And soda pop has high fructose corn syrup is one of the main ingredients. And the other part of my talk was about the toxicity of sugar. I actually said sugar as the other deadly white powder in relation to heroin and cocaine. But actually there's a lot more deaths that are related to sugar. In 2017, there was about 70,000 deaths from illegal drugs and prescription drugs combined, whereas there are over 300,000 deaths that are related to sugar, sugar-related diseases. It includes high blood pressure, coronary artery disease, diabetes, that's directly related to sugar. So unfortunately, in both of these cases, if they would have just gone to the doctor, gone to the emergency room, if they would have just gone and had it checked out, a simple blood test, a urine test, could have shown that their blood sugars were elevated, and they could have gotten treated and perhaps would still be alive now. So very unfortunate that easily treatable diseases had to end in death. But according to the CDC, diabetes is the 7th leading cause of death in the United States. And in 2015, over 79,000 death certificates listed diabetes as the underlying cause of death. And in that same year, around 252,000 death certificates listed diabetes as either the underlying or contributory cause of death. So there are many deaths due to or related to diabetes. And we have two cases here where they didn't even know they had diabetes or didn't even realize how serious the disease was. The one had type 2 diabetes, so he was being treated. He was on metformin. Now, if he did have flu-like symptoms, if he had the flu the week prior, that's a stressor to the body that could have raised the cortisol level. When the cortisol is elevated, it can elevate the blood sugar. So that might have been what tipped him over. I don't know when the last time was that he saw his doctor. Was it just getting worse? But the fact that both of them were drinking soda pop right before they died. And in another video, I will talk about sugar and how fructose is particularly associated with fatty liver disease, diabetes, and insulin resistance. So that was the wrong fluid to be drinking in their situation. So the last video got cut off a little. I am still improving my technical skills here with videos, but anywho, yeah, I just wanted to present those two unfortunate cases just to show how serious diabetes is. It's still the 7th leading cause of death, and it is related to obesity and being overweight and poor diet choices. And sugar is very addictive. It's very addictive, so I know that it's a struggle for a lot of people to avoid it. So as a forensic pathologist and as a life and weight loss coach, I just encourage you to see your doctor on a regular basis. Get your blood sugar tested, get your blood pressure tested. All of those things are very easy tests to have done, and the diseases associated with them are insidious. That means people can have them and not even realize it and yet they're very deadly. So it's just important to know, to be aware of what's happening in our own bodies. And then if you're struggling with weight loss, or you're just want a little bit of help in terms of how to live a better life, how to make better choices, then I would encourage you to work with a coach. I would love for you to contact me and talk about what it's like to work with a coach and how we can help you to reach whatever goals that you have for yourself. So again, my name is Dr. Zelda Okia. You can reach me on Facebook. I'm on Instagram, LinkedIn, or you can reach me on my website, www.zeldaokia.com. I would love to hear from you. Thanks again for watching this video.